Yeah, so I mean, I think first off, it's very appropriate for any person, and certainly someone who is pregnant, to, you know, want to make sure anything that they are doing and any medication or vaccine that they're getting is safe to get. So I think it's very appropriate to ask that question, especially for a medication or a vaccine that is new. And so, based upon the data that is thus far available and based upon guidance from our professional societies, the American College of Obstetrics and Gynecology, as well as the CDC, we are now overtly recommending the COVID vaccine for pregnant patients. When the vaccine first came out, the recommendation was that we discuss the vaccine and clearly acknowledge the limited data that was available, but that we should not withhold the vaccine from pregnant patients because we do know that pregnant patients are at increased risk for severe manifestations of COVID. In the subsequent, 8-9 months since this has been released, there is growing body of data really indicating the safety of this vaccine in pregnancy. I know initially when this came out, there were, some concerns about the vaccine causing infertility in non-pregnant patients. All of the data that has come out so far has not validated that. There is no evidence of the vaccine increasing the rate of infertility. When a patient is pregnant and becomes infected with COVID, there is about a 10 to 12 per 1,000 rate of being severely affected enough that they end up in the ICU. And that contrasts with about a 3 to 4 per 1,000 for women of equivalent age who are not pregnant. So about a 3 to 4-fold increase in risk of ending up in the ICU. And while those absolute numbers are not extremely high, that is a pretty significant increase in risk. So we do know that pregnant women are much more susceptible to severe manifestations of COVID-19. Actually, quite the contrary. Those who have pre-existing medical conditions, typically that's all the more reason to get the COVID-19 vaccine because they are more prone to severe manifestations of COVID-19 should they contract it. So those who are immunocompromised, those who have diabetes, those are the patients who actually, I would even encourage this more for. Really, those who shouldn't get it are those who, have demonstrated an allergic reaction to similar vaccines. The CDC is running a database of pregnant patients. It is called Be Safe, that any pregnant patient who has received the COVID vaccine can actually participate in. They could actually just Google this and look up CDC, the letter B, and then Safe, and then could participate in that. And it's a smartphone-based repository of information regarding people's experience with the COVID-19 vaccine and pregnancy. And they have collected over 140,000 patients who are pregnant who received the COVID-19 vaccine, and really have seen that the complication rates for those who receive the COVID-19 vaccine are the same as those who don't. So, is it true that some people who receive the COVID-19 vaccine rate have something bad that happens later on in pregnancy? Yes, but that's the same rate of those things happening as those who don't receive the COVID-19 vaccine. So overall, answering your question in a more succinct way, I would recommend the COVID-19 vaccine for pregnant patients, and putting my money where my mouth is, if my family member was pregnant, I would recommend it to them.